Myth number 3. If you are healthy, it's almost impossible for you to be killed by an infectious disease in modern times. So, this myth is a little bit harder to disprove just with kind of cold, hard numbers, just because of the way that subjects in case studies and research are documented. Most of the times they're just focusing on who got the disease, who was hospitalized, who died, those sort of numbers. They're not always, that I could find, breaking it down by how many subjects had certain illnesses prior to their diagnosis. I did find some of that, but basically, I'm also going to show here, just based on ages alone and sheer numbers of, here starting with COVID, the over the main 3 years of COVID here, the majority of the deaths, of course, before we had vaccinations, 2020 and 2021, and then the deaths started to go back down in 2022 as more and more people were getting vaccinated. But if you just look, and because this chart, the numbers are just came out kind of faint, sorry, so I broke it out for you on the side here. Under the age of 15, there was 1,149 deaths. Just going down here, and they accumulate. So I just continue to add up each decade up until you get to under the age of 54. Those 3 years in total, there was 115,202 deaths from COVID. So basically, to say, there's nobody who would reasonably think that even the majority of those people died under 54, 44, 34 because they were also ill. And with the statement being, if you're healthy, people don't die from these diseases. That's just, I mean, just on the surface, impossible to believe given the ages here. So, unveiling the impact of COVID-19 vaccines. So this specifically, this study was on the efficacy of the vaccines, but it was one that I did find that broke down to some of the pre-existing conditions that these subjects had. So I figured that might be helpful. So this was a meta-analysis, meaning they looked at several different studies, total of 7 studies with 21,618,297 COVID-19 patients. So looking at a huge portion of data, they were all included in the analysis. Just again, kind of, it's an aside here because it's not the myth that we're looking at right now. But with that amount of subjects they were looking at, the rate of the mortality rate among unvaccinated versus vaccinated patients, meaning the death rate, was 2.5 times higher for the unvaccinated patients, indicating that the unvaccinated patients were 2.5 times more likely to die from COVID than the vaccinated. It specifically looked at studies that included illnesses in order to highlight differences in outcomes between those with chronic illnesses and otherwise healthy. The illnesses that they looked at were diabetes, kidney disease, lung, cardiac, disorders of the nervous system, and immunocompromised patients. So, of the unvaccinated group, only 2,311 of those participants had established chronic illnesses. And that was out of a total of 11,714,479,000. So the remainder of those participants had none of the chronic illnesses that were stated on that previous slide. So in essence, you can consider them otherwise fairly healthy. And of the vaccinated group, being with the total of 9,903,749, there were only 802 subjects that had at least one of those documented chronic illnesses. And because this was a meta-analysis across multiple studies, it was not able to break out specific percentages of how many deaths in either group had pre-existing conditions, meaning taking the vaccinated group, it did not provide a percentage of deaths that were out of those 802 people compared to the people without pre-existing conditions. But there are still some assumptions we can make looking at this data that was provided. So in that vaccinated group, the total deaths was 35,148. And we can say that if all of the 802 patients that had chronic illnesses in this group, if they all died, which we do not know for sure, then it would only account for about 2.3% of those deaths. And in the unvaccinated group, total deaths were 104,337. And if 100% of those 2,311 subjects with chronic illnesses died, that would account for almost the same, about 2.2% of that group would have died with chronic illnesses. So all this to point out that there's lots of healthy people that died with COVID-19. This chart looks at death rates in another perspective, specifically looking at 2021 and only in high income countries, what were the leading causes of death. So this is basically, you're looking at countries that have advanced science, advanced medicine, the highest level kind of medical breakthroughs available to those that can afford them. And well educated, the country as a whole, well educated on the importance of preventative health care and making it available. And even given that, the second highest cause of death in 2021 was COVID. And so this gives you an idea, again, looking on a global perspective of what an impact COVID made on the death rate throughout the world. We are looking at, this bottom line is the amount of deaths by millions. So in 1 year, it was close to 2 million deaths, second only to ischemic heart disease. So now you guys are in for a real treat, because now I'm going to dispel a myth within dispelling another myth, a real twofer for y'all. So the next thing I always hear right about this point when I'm pointing out these astronomical death numbers caused by COVID in healthy individuals, in young individuals, is that how do we actually know that COVID caused those amount of deaths, as opposed to hospitals inflating the COVID stats to get increased reimbursement from federal funds? Well, so glad you asked. So, and this is just, it's just such an amazing thing. I feel like during this COVID period, I just realized I don't know. I do know. I know it caused some craziness because people were trapped inside and everybody was angry and scared. But wow, what a psychological experiment in seeing the extent that people that I loved and respected were willing to go to explain things like videos of body bags piling up in the streets of New York, ambulances lining the streets in New Mexico, multiple states, but just so they could load dead bodies in them. And yet people were still saying things like, well, I know a nurse that said that, or my sister's a nurse that said that there was a patient that had COVID-19, but she came in with pneumonia and ended up dying. And they said it was because of COVID-19, but it clearly wasn't, because the hospital knew that if the higher their numbers of COVID admissions, COVID infections, COVID deaths, then they would get more of that federally allocated money. So, wow, let's look at that. That's actually a fairly easy one to dispel. Um, Here are total annual deaths in the US from the period of 2000 to 2023. And anybody can, again, here's your link, anybody can go look up um, death trends, birth rates, whatever. And what you're looking at is basically the amount of people that died in our country in each of these years. Here we're going along pretty much the same. And then from 2019, where are we? 2019 to 2020, boop, spike. And 2021, it goes up slightly, but it was in April of 2021 that vaccines became widely available, where it wasn't just, it started out being healthcare workers and elderly. So then death rates started to decrease again going into 22 and 23. So that is the US. Of the excess deaths recorded in Europe. So excess deaths are determined by the recorded number of deaths each year compared to the predicted number, which is based on that same sort of average we were talking about over the prior years. They take a period of time, 5 to 10 years, and say, okay, the average deaths for this area have been this, and this is what they actually were for the years of 2019. This is all of Europe. 2019 was an extra 94,000. 2020 was an extra 401,654. This, my friends, is not fake news. These are people that died, have health records that died. You could think that they fraudulent put COVID-19 on their death certificate, but who cares? The point is, when you have this many more people die, not just in the previous year, but for the previous 10 years, 20 years, this is things that scientists go back and look at and say, oh, what happened here? And sometimes it's the plague, and sometimes it's COVID-19. We lived through our plague that was called COVID-19, and there is no falsifying that. Here, once again, if you want to continue to deny this black and white facts, then that's something that you'll need to discuss with a doctor, not a doctor of physical therapy. So, moving on from that, tuberculosis coming back up, making a comeback into our national conversation as yet another vaccine preventable illness that is making a resurgence due to cutting of USAID funding. So they state like 26 different countries that USAID was providing resources to hold up TB clinics that have already experienced closures and so a disconnection in the medication chain, supply chain, loss of research in TB, which we were leading in. So the stats here are that 10.6 million new TB cases are diagnosed worldwide, which was a little mind-blowing to me since in this country, we generally don't think of this as a problem anymore. But there is 1.3 million deaths due to TB each year. 1 in 6 of those deaths occur in people without HIV or other significant comorbidities. TB is one of those opportunistic infections that is more common in people once they have had their immune system weakened by HIV. The emergence of multi-drug resistance TB poses significant treatment challenges, even for otherwise healthy individuals. This is where we see a lot of complications with people who have no other medical history or diagnoses. When somebody loses access to their current treatment regimens due to lack of insurance, or like I said, with the cutting of USAID, in poorer countries, lack of a breaking of that supply chain, the immune system can become resistant to standard treatment regimens, which has led to death